And then if we look at the actual application, so how is a device like this used in a therapeutic setting? There are many, but still there's some common modalities. So this is most applicable in any kind of physical medicine space. So chiropractors, physical therapists, people that are working with the musculoskeletal aspect of the body. And so if we take, for example, chiropractic, which is probably as an industry the largest adopter of whole body vibration, so the earliest and most significant adopter of this technology as an industry. Chiropractic traditionally is about spinal adjustment, and so we have specific programs on the TheraVibe for that industry particularly. So when a patient goes along, they can do a quick pre-treatment conditioning session on the TheraVibe that relaxes them and makes that adjustment a little easier for the doctor. And then once they've had that adjustment, they go back on the machine for kind of a follow-up treatment which settles that adjustment, and it helps the body cope with nervous system changes. So it improves the outcome, the health outcome. So we've got, using that as an example, very specific programs for doing very specific things in the context of a practitioner's day-to-day operation. Because what we want is, we want the device to be useful. So we don't want it to be up to the physician to figure out how they're going to use this thing. That's our job, to make it easy for them to use it so that it can just segue into their normal business practice and normal mode of operation. So that's another area where we've gone beyond the industry standard, if you will, in developing many and varied customized programs for particular applications. And that means that you stand on the platform, you press a button, and it's hands off. You don't really need to do anything else. So that makes it, that improves its utility in that kind of business setting, commercial setting.